Hello, welcome to QuickMedTalk, your online destination for medical lectures. Today's topic is going to be on epistaxis. By definition, epistaxis is a medical term for nosebleed, a common presenting concern in the emergency room. Blood supply to the nose. The nose is richly supplied by both external and internal carotid system, both on the septum and the lateral wall, as shown in the diagram. Litus area. The litus area is a common site of bleeding in children, situated in the anterior inferior part of the nasal septum above the vestibule. It's made up of four arteries: anteroethmoidal artery, septal branch of supralabial artery, sphenopalatine artery, and the greater palatine artery, as shown on the picture on the right. This area is exposed to drying effect of inspiratory current and fingernail trauma. So these arteries will anastomose, forming a vascular plexus called the Kesselbeck plexus. Then we have the Woodruff's plexus. It's a plexus of arteries situated inferior to the posterior end of the inferior turbinate. It's a site of posterior epistaxis in adults. Etiology of epistaxis. In most cases, the exact cause of epistaxis remains idiopathic by their systemic and local causes. Local causes such as nasal irritation, which can be nose picking, CPAP therapy, excessive nose blowing, and intranasal drug use such as cocaine. Nose picking being the most common cause of nasal irritation. Other causes, such as inflammatory disorders like allergic rhinitis, bacterial sinusitis, and rhinosporidiosis. Nasoseptal defects such as deviated nasal septum, septosphere, and septal perforation. Tumors of the nasopharynx and the paranasal sinuses. Example, juvenile nasopharyngeal angiofibroma and squamous cell carcinoma. On systemic causes, we have bleeding disorders such as von Willebrand disease, severe thrombocytopenia like leukemia, and hemophilia. Other causes such as liver disease, example clotting factors deficiency, kidney disease like chronic nephritis, pregnancy, hypertension, and drugs. Classification of epistaxis. Epistaxis can be classified as anterior or posterior epistaxis. On anterior epistaxis, this is bleeding from the nostril, accounts for 90% of cases. Peak incidence in children is less than 10 years of age, common in the Kesselbeck plexus, which is the litus area. Posterior epistaxis. This is bleeding through the posterior nasal aperture with bleeding down the throat. No external sign of bleeding, associated with hemoptysis, hematemesis, and melena. It accounts for 10% of cases, common in elder individuals above 50 years of age located in the Woodruff plexus. The diagram on the right shows both anterior and posterior epistaxis. Management of epistaxis. Immediate management. Stabilize the patient using the ABC approach. Immediate hemodynamic support if in hemorrhagic shock. Keep the patient's head elevated and tilted forward. Control bleeding by applying uninterrupted bilateral pressure. Pinch the nasal ala against the nasal septum for 15 to 20 minutes as demonstrated in the picture. Management for ongoing bleeding. For anterior epistaxis with bleeding site identified, consider topical vasoconstrictors such as oxymetazoline and phenylephrine, nasal cautery, and if bleeding persists or bleeding site cannot be identified, place a nasal packing. Options of anterior nasal bleeding management are nasal cautery, which can be chemical like silver nitrate or electrical cautery as demonstrated in the diagram, or anterior nasal packing using salt gauze in adrenaline or paraffin as shown. While posterior epistaxis, we can use Foley catheter or nasal packing with a Foley catheter if bleeding persists, as demonstrated in the diagram. Thank you for watching. Don't forget to like, comment, share, and subscribe. In the bio, you'll find the link to our Instagram, Facebook, and SlideShare account.